Right now, President Trump is in England for a rare second-time state visit. We're going to bring you the very latest from Windsor. And
Hi, everyone.
Hi, Yana.
Good morning.
How are you?
I'm good. How are you?
Morning.
It's been hard. I just lost my cat yesterday, so it's.
Oh, I'm so sorry to hear that.
Oh, I'm so sorry.
I'm gonna try to do my best to get through it, but my brain's not been on everything.
Totally
Oh, of
understand that.
course.
Uh,
Yeah. Good morning.
Good morning.
Morning. All right, where are all my people? Hold on. People are texting me. Okay. All right, you're letting people in then,
Yep.
Tara? Okay, great. I'll just let everybody in for a moment. For some reason, I have to change my view. Okay, I only have. I only have 4 people. There we go. Okay.
I was gonna say that's not the case. There's
I know.
more than 4.
Like, there's everyone. All right. Good morning. Okay. Do we have a quorum then? I think we do.
Hold on 1 second, Carol.
Okay.
Yes.
All right. Let's get started. Thank you everyone for joining. My name's Jimna Miller, and this is the Autism Council for the state of Connecticut. I'm the chairperson, and joining me is my co-chair, Yana. Say good morning.
Good morning, everyone.
Thank you for joining us. Today is September 17th, and I'm just here to welcome everyone. This meeting is being recorded, and the URL, the Zoom link, was posted on our website as well as the agenda. So I just wanted to welcome everyone, and to get started, I believe we can move to review the minutes from our last meeting. If everyone's had a chance to look at them on the website, if there's any comments or any edits that need to be made, please either raise your hand or let us know. And I'll wait a moment before looking for a motion. Okay, hearing no edits or comments, may I have a motion to approve?
I approve, Carol.
Do I have a second?
I'll second.
Okay.
Julie will.
All right. Thanks very much, Julie. Okay, moving next on our agenda. We do have an update on some of the membership here for our council. We had some vacancies that have finally been filled. So I'd ask Tara just to make that announcement. And then I think because it's been some time and we have had some new appointments, it might be worth going around the room here, or Tara, if you can call us up just to make sure everyone knows who each other is. It's been a busy, I don't know, 12 months here on the council. So, and also for the public record, I think the public would like to know who everyone is. So Tara, if you could go ahead with the most recent appointment, and then if you could read off our membership, everyone just give, they're appointed or they're with an agency and in what capacity they're sitting here on the council, just for the public record. That would be helpful. Thank you.
Sure. So I'll do a quick introduction of myself first, and then I'll jump into appointments. So Tara Vines, I am the statewide autism services lead planning analyst at the Office of, Policy and Management, as I'm letting people in. I provide administrative support to the council as the state agency and that oversees the council. And then Lynn is our newest appointed member by Speaker Ritter, and she was not able to get off work to join us today due to late notice, but she will be in attendance at our November meeting. So now we are at full complement. All appointed positions have been fulfilled.
And Tara, tell me who Lynn was replacing?
She is representing a person with autism, so she will that's the position that she's filling.
Okay, I was thinking of hospital for special care.
Oh, no,
When
no,
I
no.
heard, when I heard, okay.
Yeah, that's Megan. I don't know. She's probably on too, but I will go through and just call people out one by one if
Great.
you'd like me to do that. And I'm just going to go in the order I see people on my screen. So Anne from DPH, do you want to introduce yourself, please?
Sure. Good morning. I'm Anne from Department of Public Health, and I am here from Public Health. I'm the Title V Children and Youth with Special Health Care Needs Director for the state of Connecticut and the supervisor of the Adolescent and Child Health Unit.
Thanks, Anne. Brian Klimkowitz.
Good morning, everybody. Brian Klimkowitz, I'm the Special Education Division Director at the State Department of Education. Tara, that's a perfect pronunciation of my last name, so you get an A+ for the start of the year.
Thanks.
Most people just say Brian, no, but it's great to be
Brian K. That's what
Brian
everyone
K.
says.
Yeah. When I was a teacher, my kids, so I was Mr. K all the time. But having said that, so excited for the year ahead and to collaborate with you all in this important council.
Thanks, Brian. Carol.
Hi, Carol Ryan Hannon. I'm a licensed professional in the state of Connecticut working in the field of autism. I'm also a board certified behavior analyst and owner of Interlocking Connections, which is an agency that provides a lot of different services, one of them being providing services to people on the autism waiver.
Thanks, Carol.
Yep.
Christine.
Hi, everyone. Christine Faressa. I'm from Watertown, Connecticut. I'm on the board as the parent of a child with autism, but I also have a bit of a unique background. I'm on the Board of Ed in Watertown, Connecticut, so I see things from that perspective. And I also run a nonprofit for almost 10 years now, Sun, Moon, and Stars, and we provide a lot of events and activities for families with autistic children. So I'm really happy to be here to help lend my voice. So thank you.
Thanks, Christine. Next, I have Jennifer from Demas.
Oh, good morning, everyone. I'm Jenna Batamarco. I'm from the Department of Mental Health and Addiction Services. I'm actually our commissioner's representative on this council. I am also the Director of Operations for the Young Adult Services Division here at the department.
Thank you. And then I have, let's see, Julie Wolf.
Hi, everyone. I'm Julie Wolf. I'm a clinical psychologist at the Yale Child Study Center in the Autism Program. I'm on the council officially as a representative of an institution of higher learning, but I also have a brother on the spectrum, so everything I do is kind of shaped by that experience as well.
Thank you. Marcia Eckert.
Hi, I'm Marcia Eckert. I'm a clinical psychologist. I've been working with the both children and adults on the spectrum for about 30 years. I hate to admit it's longer because that makes me just older and older. I am an individual provider who works with people on the spectrum, but Tara, I think I have a different designation. I'm not sure.
I think that you are under a person providing services.
Oh,
That
okay.
is that is the official appointment.
Okay. Nice to see everyone.
Thank you. Melissa Hoon.
Hi, I'm Melissa Hoon. I am a licensed clinical social worker in Newington. I have a private practice where I work with individuals with autism. I also run social events for individuals with autism and run 8 groups a week for adults on the spectrum, both through the waiver and through private insurance. And I hold a position as a provider as well on the council.
Thank you. Let's see, Melissa Paul.
Hi, everyone. I'm Melissa Paul. I am a former school counselor who now works more on the higher ed side on a college access and college success nonprofit. I believe my appointment is as an advocate for a person with autism, and that would be my son, who's 6 years old and is in the West Hartford Public Schools.
Thank you, Melissa. Kathy Marchione.
Good morning. I am here as the designee for the Commissioner of the Department of Aging and Disability Services, and I am a bureau chief in the BRS portion of ADS, which is what probably most people affiliated with this council are know us as.
Thank you. And Mary Miller from OEC.
Hi, Mary Beth Miller. I see my name doesn't fully populate
Sorry
that.
about that.
No, that's okay. I go by almost anything, so that is absolutely fine. I am here representing the Office of Early Childhood. I'm a staff attorney 3 there. I also have a child with autism. So much like everybody else, we have mixed roles.
Thank you so much. And Dr. Schlegel.
Hello, everyone. I apologize for being a few minutes late. It sounds like we're introducing ourselves and our role on the committee. Okay. Or on the council, excuse me. So I am Sarah Schlegel. I'm a developmental behavioral pediatrician at Connecticut Children's. So my role is a physician who diagnoses and treats, manages, and supports individuals with autism spectrum disorders. And while our being a developmental behavioral pediatrician is, largely I see, younger children, pediatrics. I actually do, one of my special interests is adult transition to adulthood. And so I see patients up through 26 years of age and specifically work on that transition period. So just putting that out there.
Thank you. Carrie.
I'm sorry I joined late, so I apologize for not knowing what the question was.
We're just introducing ourselves.
Okay, I'm Carrie Sasu. I am a psychologist, a professor and director of our Autism Center at Southern Connecticut State University. I work to train individuals who are going to work in the field of primarily of education as counselors and related support professionals. And I also happen to also have a child who is 17 and has autism.
Thank you. And Susan.
I am Susan Stang. I am from the Department of Social Services. I am the Autism Waiver Manager, and I'm here representing the department for Christine Weston, the Director.
Thank you. And Yana.
Hi, I'm Yana. I'm a self-advocate. Also receive services on the autism waiver, and I'm also a historian and a graduate student.
Thanks, Yana. Okay, and I think I got everybody who is appointed and representing a state agency. Let me just run through my list that is in attendance today. Okay. All right, Jim, and I'll have to turn it back over to you.
Okay, thank you so much. I hope that was helpful for not only the council members, but also for public to get a reminder as to who is serving on the council and who's been appointed. Next on our agenda I do want to welcome Susan, and if if you're ready, I'd like to invite you to provide some waiver updates.
Sure.
Do you have a slideshow today?
I do.
Okay,
I
give me
promise
1 second. I'm gonna
Okay.
need to let you need to allow. Okay, you should be able to.
Okay. I think, is that coming up? Am I sharing?
Not yet. I
Yeah.
don't see it yet.
What about, oh, I see. Okay. Sorry. What about now?
Now we
There
can
we go.
see it.
All right, good. So this is our autism waiver services report. So we're going through a little bit of a transition right now. Our supervisor of the program has retired, so we're, you know, we were already going through a little bit of a transition, trying to make some improvements to the program. So now even a little bit more so. So the current wait list is 2,447 people. It keeps growing. We are trying to get people, improve the process so we can get people off of the wait list and onto the waiver. Currently, we have 262 cases currently active on the waiver. We did a recent case manager audit that shows an average of 31 cases on each caseload. We're in the process of cleaning up those caseloads and resolving some systematic issues that I think can really bring some improvements once we resolve them. We have current vacancies for case managers and the case manager supervisor, as I said. We're still working on growing in our improvement plan. We've gotten some ideas for, as we're brainstorming to try to figure out how, one of the biggest problems, as you know, is outreaching for new providers. We have the ideas of coming up with a presentation with information regarding how to become an autism services provider. And we want to share it on the DSS website and then also forward it to regional community collaboratives so that it's very clear how, what the pros are of becoming an autism services provider and how exactly to go about doing it. I think that we've gotten a lot of calls where people will say, oh, I just heard about how I can become a provider and I never knew, after all these years. So we want to make that a little bit more publicly knowledge, that knowledge available to people. Also brainstorming ideas for outreach to individual hire employees, which I know that we've mentioned on the council before about posting flyers at local colleges. So we also have available training that is paid for, that they can join if they decide they want to become a provider on the waiver. So sort of a fact sheet, even the kind of flyer that you can tear off the number, any of those, the more of those that we can get out, I think the better. Also sending out a memo through the GTI portal, letting current employees with low hours know that there are more opportunities available, because I think there are some people that work part-time that might want more hours that don't know how to go about getting those. So we would have the ability to send that out to all the current employees. And then bringing people onto the waiver, we're making progress towards a quicker process of getting individuals onto the waiver and receiving needed services. we have a dedicated person now reaching out to the next group coming up on the waiver so that they can get all the documents ready and prepared so that when they're ready to come onto the waiver, they have everything. Because we found that people were, the next person that would come up on the wait list, there's a lot involved in going through that process, and it would take, 8 months or so. So we want to shorten that. So we're doing that ahead of time so that when they're ready and there's a spot, that they're able to quickly be brought onto the waiver. So we're working hard on trying to make that better. So that's all I have.
And it looks like we do have a few questions. So, Gemina, did you want to go first? I think I saw your hand raised first.
Yeah. Hi. Good morning. If you go back to your last slide.
Yeah.
For thank you. For brainstorming, who on your team or who would be responsible for doing that sort of outreach? I'm presuming it's not case managers. They already have enough on their load. And I see you have a dedicated person, for the process improvement. I just didn't know if there's any opportunity to, like, we do have, providers, we do have educators, on the council. And I didn't know if that process had already, started and kind of cross-pollinating, or maybe this is as a result of our education subcommittee. Can you just provide a little context on that, if you would?
Sure. Yep. We have not developed a presentation yet. However, we have a resource specialist on our waiver team that is also the one that reaches out and has also been going to, over the years, going to all the events and that kind of thing. So he is the one that will come up, he already has some presentations, but we want to go over it and make sure that it's applicable to what we're trying to say. So he is the one. We would welcome any more information or help or anything that you guys want to send me that you want to be included or that you think would, in the education committee. So any help that you guys want to give, we're happy to have and include.
And Susan, once that's created and it's on the DSS website, we can link it to our autism page as well.
Okay.
So as long as Nate sends me that link, like, and when it is posted and up, I can link it directly on our page as a resource as well.
Great. Okay.
Yana, you had your hand raised?
Yes. Hi. I just wanted to talk about this concern ongoing concern. And I think Tara, you and I spoke about this because I really do want to bring it up. The GT independence, the financial intermediary, their work is unacceptable. They don't pay my staff correctly. They say that they weren't given paperwork when my case manager did give them the paperwork. They're not paying my staff the correct rate. It's just been a mess. Their customer service is also not very good. And I know that it's not just me. I talk to other families and they're having the same concerns. And if you look under GT Independence, under their Google reviews, it's pretty brutal. And I think our families deserve better. They have enough stress on their hands. I think they deserve better. They deserve a financial intermediary who's competent, who can do the right job, who pays their staff, because people are going to lose staff. My staff she was so frustrated that she was at the point of wanting to quit because she wasn't getting paid correctly. Luckily, my mom said that she would pick up the slack and we would private pay the money so that she wouldn't leave, but it's not acceptable and something needs to be done.
Absolutely. 100% agree with you. And you are not alone. This is something that we're dealing with and have been working with GTI even more so now. We've had some high-level meetings with them, and we have an escalation process that we work on that when an issue like that is brought to a case manager, we have a escalation tracker where we enter it on to, and then the managers and the case manager and GTI have access to that. And then we also have ongoing meetings every week, multiple meetings every week. One of those meetings is specifically about autism, because we found that there's some systematic issues that have happened with GTI that is causing people to get paid incorrectly, or the codes to disappear, or that kind of thing. So it's a systematic issue that they're fixing, and we're doing the best that we can to fix that and hold them accountable, and working through it. And I'm hopeful that it will shortly be fixed, because we've identified that problem. So on behalf of the department, I apologize to you and everyone else that is experiencing that problem, because it's definitely causing, people need to make the money and they need to get paid. It's people's livelihood. And I don't want people to lose their services because somebody decides I'm not getting paid, I'm going to quit. So your story is definitely a story that we're hearing, and we're really working hard to fix it. If you want to, if you have, I don't know if you've spoken to your case manager about the issue, and if they have gone through the process of
Well,
entering.
Amy James, my case manager, she's been on it. She
Yeah,
said they do the same thing. She escalates it, but
yeah,
the system is impossible. You have to go through their customer service system, and it's impossible. It would be nice
yeah,
if, one thing would be nice for them to do is to have a specific staff member dedicated to specifically to our individuals, and maybe a line specifically for our individuals to call, where they can get to somebody without all of the red tape.
yeah, yeah. I'll bring that up. When I have the meeting with GTI weekly, specifically about autism, I give them specific examples of customer service issues that have gone wrong, but they have decreased their wait time. I don't know if you've noticed that, but they have made some strides towards improving that. And I'm hoping, going forward, that the rest of the issues will be improved, especially the rate and the code issues seem to be the most prevalent.
Yeah, I'm hoping, because I don't want our families have enough on their plate. They don't need to be dealing with any additional stressors. And then when you get a good staff, like I have now, we just hired her. We really want to keep her. Luckily, I have resources. My family, my mom's been paying her the correct amount of money, but other families might not have that.
Yeah, I agree 100%. Thank you for bringing that up, though, because
Oh, you're welcome.
yeah.
I just wanted to mention to the new people, I do have a little litmus test that I shared with the other council members. Before you suggest something, or if you want to do something, the litmus test is this: is it the best for our families and our individuals? Will it benefit them? If it's not, then it's not something you want to bring up. Because we're here to serve our individuals and our families. They always come first.
I love
And
that. Yes,
I just want everybody, the new people, to realize that it's not about you or prestige or money. It's the families and individuals.
absolutely. Thank you very much for that.
Thank you, Susan. Thank you, Yana. Do we have any other questions, comments?
I don't see anything in the chat or hands raised.
Okay, thanks so much, Tara. It looks like next on our agenda, we have Jennifer Crom. For a
Hi,
Carolina
everybody.
update.
Yes, hi. Let me see if I can share my screen. Here we go. Just sharing.
It's doing something.
Yeah, it's coming up.
Oh, everybody froze.
There it goes.
There
You
you
can
go.
okay. There
Yeah,
was a
we're all good.
delay. Oh boy. Okay. All right. So since there are some new members here today, I wanted to first start with an overview of the Connecticut Behavioral Health Partnership. So the Connecticut Behavioral Health Partnership, or CTBHP, is composed of Connecticut's Department of Social Services, Department of Mental Health and Addiction Services, and the Department of Children and Families. Carillon Behavioral Health Connecticut operates as the administrative service organization for the CTBHP and is responsible for reviewing and authorizing all behavioral health levels of care for all Husky Health members. My ASD team also works very closely with the Department of Developmental Services, since many of our individuals also access services and supports through them. And then just to provide an overview of everything at Carillon Behavioral Health Connecticut. So the CTBHP is everything on the left in the black. That's what I just discussed. And on the right in the green, we also have a contract for the Child and Family Division, which supports individuals who have had some DCF involvement, whether it's been substantiated or unsubstantiated DCF investigations, and requires some further assistance. And that is regardless of insurance. So even individuals who have commercial insurance are able to access those services. And then just a little quick history on the autism services here in Connecticut. Back in January 2015, as part of the mandate for states to cover autism services through insurance, the Department of Social Services expanded that coverage for autism evaluation and treatment services for individuals on Husky A, C, and D under the age of 21. And then as of 2016, July 2016, Carillon took over the qualification of the providers who were interested in enrolling as ASD Medicaid providers. So because of the vulnerability of the population, we recognize that there was a higher level of qualification, which should be required for those providers. So they do submit samples of work, their resume, their credentials, and that is a re-enrollment process that does happen now every 5 years to ensure that they're still meeting regulatory guidelines as set by the BACB and DPH in Connecticut. I also, very exciting, have some new service classes that we just educated all of our providers on. We've been hosting forums throughout August and September, and we're able to educate our ASD Medicaid enrolled providers on important updates to the autism spectrum disorder services, which became effective July 1st and are specified in the CMAP Provider Bulletin 2025-30. I'll send out that link with the PowerPoint so that Tara can get that out to everybody if they'd like to read through that. That provider bulletin included the addition of new procedure codes for parent training with and without the child present, and for case management. So two services that our providers have been asking for since 2017. So very excited that that's finally been put in place. We also made some updates to the authorization parameters for behavior assessment, treatment plan development, and program book development to allow for some more time for providers to do these assessments and put together the reports. And we also included criteria for if they needed to request those things more frequently. So the behavior assessment treatment plan program book is now available every 6 months as opposed to 90 days, but with extenuating circumstances, hospitalization, emergency room, what have you, for children that could impact their behavior, they are able to request those more sooner than that. And then we've also made some revisions to the claims parameters that impact the autism diagnostic evaluation. So a lot of that was in response to some fiscal concerns across the state and hoping to make some budget neutral recommendations. We're hoping to see that in our data over the next year or so. And then we also heard loud and clear about the staffing challenges for our providers and made recommendations which also were put through for the behavior technician qualifications. So prior to July 1st, behavior technicians had to meet at least an associate's degree or a bachelor's degree with education in a related field and experience. So we made some changes to that to accommodate also including individuals with a high school diploma and a registered behavior technician credential. So very excited about that. I know a lot of our paraprofessionals in the state meet that criteria, so we were really excited to be able to expand that and hope to make an impact on the staffing challenges for our providers. So those are the cool new updates. And then I also have our data review for August. So you will see the new service class for the parent training will also be reflected in this. The authorizations just started September 1st, so you don't see many of them in this data pull since it is a stagnant pull of September 1st. And the case management, because it's an outpatient service, does not require an authorization for our providers unless it's over 97 units. So you will not see that data included in here since this data is based on authorizations. So you can continue to see here our treatment plan and program book development, as well as the behavior assessment, those two top numbers, the 8,604 and the 8,046. And just important to remember, this is a rolling 3 years of data and authorization, cumulative authorizations. The purple line here, the 5,654, those are the individuals who have been authorized for diagnostic evaluation. And then I know this number is difficult to see as it overlaps, which it should, so we're happy to see that this happens. But service delivery and direct observation and direction are authorized concurrently, so that those numbers do overlap, and it's 4,025. Our lowest service class that's authorized per usual is our group treatment services with a cumulative of 237 for the rolling 3 years. Here we see the current open authorizations. So that BA2 is the parent training. As I mentioned, that this just went live September 1st. So this was whatever authorizations were entered prior to the data pull first thing in the morning. So we do expect that number to coincide with the number of individuals connected to a provider, since those authorizations will happen concurrently as well. So we currently have 516 individuals accessing an autism diagnostic evaluation, 5,633 who are receiving direct service delivery, and that will be the same number for the parent training. And then currently 85 individuals in group treatment services. Here we look at the age of admissions. So admissions are defined as the first authorization for ASD services. Our 3-year-olds and 4-year-olds are the largest group of individuals starting services, with a total of 1,866 3-year-olds and 1,887 4-year-olds. We love to see that. It means that kids are transitioning over to their Medicaid benefit services after birth to 3. So very exciting that we see that it's a great transition over to the Medicaid services. Here are our demographics. I know it's a little bit of a different visual than what it typically is. The unknown group is defined as individuals who do not identify their race or ethnicity at the time of Medicaid application. That continues to be our largest group of individuals, with 35.4% of the individuals accessing autism services. Then we have almost 27% Hispanic, 19% white, almost 13% Black, 3% who are in another group, and then 2.3% who identify as Asian. In the pie chart, you see that the majority of our individuals are not DCF involved at almost 97%. We have almost 4% who are DCF committed or in a CPS investigation. And typically in those situations, we're working with a foster family or, a whole DCF team in order to support the child and family through services. Region 3, which is that region right along the Rhode Island border, has routinely been our lowest number of individuals accessing services. And as I mentioned, every month it's for a couple of reasons. We have fewer number of providers there. And it's much more spread out in that area of the state. It's more challenging for our providers to get out to families. And it's just a more rural area of the state, so harder for people to access services. The other challenge in that part of the state too is if we have families who speak a language other than English, it's even more of a challenge to have a provider there to support them. We then have Region 4 and 5, so that's the DCF Hartford, Manchester, or New Britain, Meriden, and that's the highest number of individuals authorized for services. They're more densely populated areas. We also have more providers in that area of the state as well. And then here we look at our provider growth. So we have a total number of agencies at 145. So those are the groups, largely made up of BCBAs and then combinations of different licensed clinicians. We break it down a little bit further so that you can see that there's a total number of 987 providers who are able to provide either the diagnostic evaluation or the direct service delivery oversight. So that's the 987. And then because it is so important to understand how many providers are actually overseeing the direct service delivery, we break that number down a little bit further, and that's the 946 individual providers. And then we look at what our care coordinators and peer specialists do. So a few months ago, we went through a whole redesign in order to better support our families accessing services. So about 85% of our families are working just with our referral care coordinator. So our referral care coordinator is responsible for sending information out to providers regarding the family's specific needs, the behavioral concerns, and the availability for the child. So she communicates weekly with the providers across the state and then follows up monthly with the member and their family about where they are on wait lists and gives them the names of the providers whose wait lists they're on so that they can also call. We also have 13.6% who are also assigned a regional care coordinator. So those are individuals who require a little bit more support. They might have some DCF involvement or need support in their DDS eligibility application or other things that require a little bit more support than just that monthly outreach. So we have a care coordinator specifically assigned to them, and those families are receiving weekly outreach by our care coordination team. Then our little teeny tiny 1% who receive wraparound care coordination, those are the individuals who are either currently at the hospital for special care inpatient unit or who have had frequent emergency room visits or inpatient stays and do require a much higher level of support. Some of those individuals might have also housing or food insecurity, so we're also supporting them in accessing those supports as well in order to achieve some stability. So just a further breakdown of our regional breakdown. So our peer specialists and care coordinators are regionally assigned to the same DCF regions throughout the state. And the reason for that is really so that they could build connections with the providers and other services and supports in those areas of the state. So just a further breakdown of our regional supports. And then our provider map, which is on our website and can be filtered to display what services and what language is used within that service center. So if it's a center-based services or in the community, and if they speak a language other than English, as well as all of their contact information is included in there. That list can also be printed and sorted in this view as well. So we do send this out to providers and school systems all across the state so that they're also able to help families access services. Any questions?
I have a few questions and comments.
Sure.
So quick question, just want to ensure that the parent training would be inclusive for those DCF foster families as well, right? That's
Yes.
going to correlate so that they're getting that if
Yep. So it's
is-
parent training,
perfect.
but it's really any caregiver. So it could be the foster parent, it could be the biological parent, it could be the grandparent, whoever that child support system is can receive that parent training.
Okay, beautiful.
Yep.
And you are tracking the authorizations and like utilization of that service.
Mhm.
Will there be any, I'm just curious to see if there's improved outcomes as a result of that service. So will there be any additional
Yeah.
outcome data that we'll be tracking?
Yeah. So Tara, you completely read my mind. Part of the reason, yes, obviously best clinical practice to offer parent training. The reason why we wanted it to be under its own separate authorization was exactly that. So we can track the utilization of it and hopefully over time see a decrease in the length of stay for children in the ABA services. We recognize that there will always be some members who require services until they're transitioning over to DDS or DMIS or the waiver, but really working to support those individuals with lower level needs throughout services so that we can increase the capacity for providers to accept new members into the services.
Perfect. And then as a piggyback off of your data, I would like to tell the group and or put it out there that there is currently a public comment open for Connecticut's application for rural health transformation. So the state is looking at in the One Big Beautiful Bill Act, there's opportunity for improvements to rural health. So one of the things, knowing that we have this data to show that there is a lack of access in the eastern, near Rhode Island part of the state. I would like to kind of put that out there if anyone on the council or any public listening would have ideas on how we could address that. I think that it would be important for us to get the word out to see if we can improve access in that area. And you mentioned one of the barriers, and I'm going to put it in the chat so everyone can kind of see how to submit those public comments. And so you mentioned there's also language is one of the barriers. So also something to consider maybe as we're looking at this, is there a specific language that is most common in that area that you have, in your data that we know of?
I can drill down. I would have to ask our data team to do that, but we can drill down per region based on not necessarily. I guess we might be able to on language. I can ask our data team about that. It really is kind of a smattering of everything, though. When I look at how we have our member flyers and information, what languages it's translated into, it really is a little bit of everything and all different dialects of different languages as well.
Okay.
Yeah.
All right. Just was curious if that was something that we could build in. So
Yeah.
I would encourage people if, there's agreement among the council and, to try to address increased access in that area to help providers, and the people who are in that area. I think it would be great for people to put your.
Public transportation is also the other huge challenge in that area of the state. They don't have the bus lines and everything like we have in, the Hartford regions, the Waterbury, New Haven areas. So I think that also poses another challenge for a lot of families who don't necessarily have access to that.
Yes, thank you. Great.
Yeah.
Gemini, I see you have your hand raised.
Oh, hi. Thanks, Tara. Hey, Jennifer. Regarding the addition or the change for RBTs and having the high school education as a requirement, I just wanted to know when we might see reporting on that. And as you were talking about parental training and KPIs, I didn't know when we might be able to
Yeah,
see some of that.
so that's a great question. So we won't necessarily, because Caroline doesn't manage the behavior technicians specifically, we won't necessarily have data specific to that. However, where we hope to see it, as of September 30th, we will have a report to our state partners that measures the wait times that providers have for once we refer to a provider, they accept the referral and then to the first date of service. So that we're hoping to see in there the impact of the staffing changes or the qualifications of the staffing so that the we're hoping to see a decrease in those wait times. And that will be able to be reported on next month. So I'll be able to show you that report as of then.
Excellent. That's great news. I'm excited and for our
Yeah.
population that we serve, and
We are too.
that's it's creative and it's about time. So congrats.
Thanks.
Okay. I don't know if there's any more questions.
It
I don't
truly
see
took a
any.
village to get all of that going.
Yes.
So yeah.
Good work. We applaud you.
Yes.
All right. I think we can move to the next topic.
Okay. I think we have subcommittees up next on the docket. Do you want to go first, Kim? I think I saw you join.
Yes, I'm right here.
Okay, great. Thank you.
Yes, thank you. So the legislative subcommittee has had 2 meetings. The last meeting, we actually had reports provided to us by the DD Council with Walter Glum. And Tara, please help me with the name of the second one.
The Rare Disease Advisory Council, ARDAC, they refer to themselves as.
Thank you.
Leslie Bennett from one of the chairs.
What was really helpful is that we got to hear their legislative perspectives and some of the concerns that they are highlighting. Obviously, there's a lot of common ground between our committee and theirs. One of the other things that we discussed is that, as you know, we were supporting a bill to raise ABA services, ideally for life, but in the proposed bill, it was till age 26. The bill did pass the House bipartisan, but was not put forth to the Senate. So I have a letter drafted and I have a template for anyone who is interested in submitting an individual letter to request that that be raised again so that we can move it forward. And that is all.
And Kim, we can just mention everybody on the council would have received an invite to that meeting. And I want to say it's on the typically on the second Wednesday or second Monday of the month at 2:00. But this coming into October, we need to meet on the 6th due to the holiday on the 13th. So our next meeting will be October 6th at 2 p.m. for anybody interested in joining.
And Tara, I just remembered, I forgot to mention that we put on our website, now available to anyone in the public, to put forth proposals that can be shared at this committee. So I don't know, Tara, if you're able to put the link in there, because I'd
I'm
like to
going to pull it
encourage.
right now. Yep.
Thank you.
And this is not just for, this is for council members too. If you have a policy proposal that you would like to suggest, you're welcome to fill this out. I've sent it out to the councils via email, but here's the link to the website.
Okay, I'm just catching up on some comments.
Yeah, I put in the chat that we talk a lot about ABA, and ABA is very, very controversial in the autism community because when it becomes compliant based, and when the goal of ABA therapy is to make the autistic child quote unquote indistinguishable from their neurotypical peers, that's when it crosses a line into abuse, because forced masking is abuse. I've gone through it. I know what it's like. It's stressful, and the child will break down. They'll come home and have from school and all this therapy, and they'll have more behaviors because they're releasing all the stress they felt in school. So we shouldn't be doing that. We should be neurodiversity affirming, which is helping them be the best autistic person they can be. And I put a link for the Neurodiverse Therapy Collective. They do wonderful work. There's more information about it because one of the things I want to work on is getting rid of these abusive practices that are therapy, but it's really abuse in disguise, such as ABA when it's not done right, and physical restraints and seclusion. Unfortunately,
I think that's a good point, Yana, that you made, that it's not always the therapy as much as it's sometimes bad practitioners. And I think one of the reasons to clarify that we're advocating for this specifically is because it is a treatment that is covered by insurance. So it allows for that early intervention and access for families. But I do think I hear you loud and clear. If there's a way that we can help, ensure that people are receiving the best clinical practice that they can. I hear you loud and clear.
Thanks. And also, don't try to correct autistic behavior just because it bothers you as a neurotypical. For example, I've seen people say, "Hey, quiet hands" when a child is flap or adult, they're flapping, spinning. All of those are normal autistic behaviors. It's called stimming. It's how they self-regulate. That kind of thing shouldn't be corrected. Just because you find it annoying as a neurotypical doesn't mean it's wrong.
I just want to pipe in too quick. It's unfortunate that I think all of our level of care guidelines for Medicaid at least are named kind of the ABA. I do want to stress though that our providers, it's required that it's an individualized plan of care for every child. So it could be more of a positive behavior support approach or a discrete trial approach, depending on their age and what's appropriate for them and their functioning level. So our clinicians really do comb through that information, Yana, to make sure that it is highly individualized. Also, our Medicaid providers are not permitted to restrain individuals. So that's not even able to be written into their plan as a crisis plan. So I do think that we try to put some safeguards in there for that. And we do, thanks to you, Yana, and a lot of people on this council, our families are much more educated in advocating for positive behavior support approach versus an ABA approach or different highly individualized approaches. So I hope that makes you feel a little better about it.
Yeah, because I've gone through the gamut on all my years. I've been
I
in
know.
programs where they say it's behavior modification, but it's really abuse. And I just don't want any other kid to go through that because it's
I
traumatic.
appreciate that,
Also, I
Yana.
wanted to mention all behavior is communication. So before you assume
100%.
that they're misbehaving and being obnoxious, try to see what they're trying to communicate to you. Because more often than not, this is a child, especially if they're nonverbal, they can't verbally communicate to you, and they don't have a talker or a text board or anything. They're trying to communicate something to you. So you get to listen to what a child says.
Completely agree, Yana. Thank you.
Always appreciate your viewpoint for our population. Thank you, Yana. Next on our agenda, I do have housing, but I'm not sure if we have our subcommittee members here.
I did not write them down as here for in attendance. So I can say that they met recently. That subcommittee is posted. And if anyone wants additional information, you can reach out to me directly or to Lois and Stephen. But we do not have another meeting set up for at this time.
Okay, and their schedule and their agenda and minutes and recording are all on the website just for
Correct. Yep.
just for
If
the
anyone wants to check it out. Yep.
Okay. All right, fantastic. Let's move to the education subcommittee.
So we don't have a chair since Lynn is now retired. So we just need to make a decision on if we would like to continue this subcommittee, if somebody's willing to chair it as a member of the council. So they were specifically working on, workforce issues and discussing ways to improve education and training for professionals to enter the field. So I don't know if we have anyone who's interested in doing that, but we do kind of need to make a decision so I can officially take down all of the meeting dates moving forward off the website and, so there's not confusion.
I personally would like to keep it open only because I feel like we finally have not finally, but we have some traction now with the Carillon update we just got. especially with what Sue just provided in terms of their improvement plan. I feel like now would be the time, I'm just N of one, but I would love to see this still going. If I need to step in to corral or get the troops together and to move this forward, I'm happy to step in. I will need help. And just a reminder, the public is welcome to join these subcommittees. Especially if you have an area of expertise, the council we need your help. So please put me down, Tara. And I'm happy I can connect with you offline and just to
Okay.
find out what next
Yeah,
steps
we
might
did
be.
have good member participation
Okay.
in those meetings. So we can find maybe a meeting cadence that would meet your schedule and post that. Obviously, the one that we had posted was, according to Lynn's schedule and availability. So definitely something that I can help administratively. And we, like you said, we have public is welcome. We just need a member to chair. So,
Yeah,
okay.
I'm
we
happy.
can
I'm
connect
happy to
and
kick that
we'll-
off.
Okay,
Okay.
thank you. And I will, then as soon as we have another meeting set, I can send it out to the member list.
Okay, fantastic. Yeah, I feel like now is the time where we don't want to let that subcommittee go away. Okay, moving to my next agenda item. We do have agency updates. So, Tara, I don't know if you've received any in advance.
I did
From
not.
anyone. Okay.
So if there's anything specific that anyone from the agencies would like to share related to autism, I will give you the floor.
This is Ann Gianette at DPH. Good morning. I just want to let everybody know that we did have our federal maternal and child health block grant review last Friday. There is, attention being paid to what's going on in the state around the information that was just shared around autism, and updates were provided. We have begun our 5-year action plan, and we'll be continuing to work on care coordination in particular and family involvement as 2 key areas. So.
Thank you for that. Will the action plan, is that going to just be on your website or somewhere where it can be accessed? Okay.
Yep, it will be available through our federal website, and it is something that I'll be able to share as well. The document is not finalized yet. We have our final edits going in on the 25th. And once that's complete, then we'll get the thumbs up to go ahead and share. But we are interested in continuing to have input into it. So it's not as though it's done at that point in time, but you'll be able to see it online. And I'm happy to share the link once that's done. I can share the link for the one that was up last year, but there's a new action plan for 5 years. So I think that would be better for me to share what we have going forward.
That would be great. Fantastic update. Thank you.
You're welcome.
And again, that is available for the public to also provide input. Okay.
Yes.
I just want to make sure that's crystal clear.
Absolutely.
Okay. All right, moving to see if there's any other agency updates. You can either put it in the chat or raise a hand. And okay, seeing none. Let's move to the last portion of our agenda. We do have new business and just open discussion right now. One of the items that Tara and I were speaking about is, and I know that this has come up before, is kind of a year in review, or it's probably a year in review. And it would just be able to list what our past accomplishments was as a council, whether it was, what the subcommittees, what was discussed or what's proposed. Obviously agency updates. The subcommittees for sure, any sort of legislation, would fall under that. I wanted to bring that up in terms of ideas, if we feel like, we would need to solicit input from different council members. So it's not just left on Tara or myself to kind of, read through, bunch of minutes and stuff and recordings and stuff like that to collect it all. But I did want to, thanks, Marcia. I do want to see if we have enough interest, or if it would be, helpful for the public, for your families, to get something like that posted. So can we open that up for discussion, and just pipe in if you think that that would be helpful, because we could, we'll set a due date for when information would be need to be delivered to Tara and I, and then we can put forth a draft to make sure it's accurate, and then we can get that posted. All right, it looks like Kim is in agreement. She's on the legislative committee, subcommittee. A lot of activity this year for legislation, obviously. Any of the other subcommittees?
Yeah, I think that and I'm grateful that we're not mandated to do a yearly report. So this would be something that we could, send out to legislators and, other, community members and post on the website, just to educate people on the work that we are doing. And so just, again, we're looking for, I'm happy to help pull everything together, just need content from the group. Okay, looks like we have some support, so. We can circle back, and then we can maybe put a due date out for information and see what people are able to contribute, and then we can see what we have moving forward for that.
Great. Thank you, Carrie. Thank you, Kim. Okay, next idea I'd like to put forth would be Autism Day at the Capitol. This continues, it's held every year. I personally was at the Capitol this year, and I know I saw a number of faces there that I recognized. However, it struck me, and in speaking with Tara, I kind of felt like we as a council should or could play a larger role in Autism Day, especially with all of the items that were going up at the legislature and the bills, et cetera. I had a chance to speak with some of our legislators, as well as I happened to be on the news with my son that afternoon. So, and he's on the spectrum, so that was exciting. But I think we have it's a missed opportunity to let the public know about the good work that we are doing. And so just like we were just mentioning, a highlight, like a year in review, one pager, doing a mid-year, or, in April, the Autism Day is held in April every year. We could put in kind of a request to either have a table that's staffed, or we're open to other ideas. I wanted to kind of check the pulse of the council and see if you also have any other ideas, or even the public. I would like to solicit ideas and just have a discussion about that, because I think we are doing good work. We have so many agencies here on the council. We have great, engagement with our members and parents here. I don't want it to be our best kept secret that we exist. We're working here. We have appointments from legislators around the state. So I think that we should, and we have great partnerships. So,
I did have an idea, a little bit unorthodox. Maybe this is something the council could participate in. If we could the council could sponsor a booth where it could be Ask a Neurotypical. So if autistic people are there and we have questions about NTs, we could ask the neurotypical, or we could do a panel where for the autism community, where we could ask a neurotypical.
I love that idea. That's so creative, Yana. And, given that we know that autism is a spectrum, a panel would be that's actually really unique and creative. I'd like to sit, I have to sit and talk with you to flesh that out a little bit, and we'd have to identify additional persons on the spectrum to join you. And I know that we now have that appointment filled, Tara. So maybe that could be a possibility too.
Well, the panel would be neurotypicals, and then the autistic people
Right.
could ask you questions like, why do you insist on eye contact? And why can't you just say what you're feeling instead of using
Right.
body language and confusing it?
Yeah. No, I love that. I think that that's a great idea. Any other ideas while we're
I
taking
actually found a
brainstorm?
shirt for Autism Day next year. It says, well, we can't all be neurotypical, Karen.
Oh my gosh, I need to get one of those for my son. Any other ideas while we're brainstorming? All right, I would also like to see if we have individuals that would even, in addition to Yana's idea, have time on your calendar to be up at the Capitol that day, and to staff, a table. We would, by that time, we would have the highlighter, the one page of highlights, and we, based on what we know going into next year, we could even have like somewhat of our upcoming, proposed projects, and, obviously priorities, etc. So anyway, I wanted to put that forward. Tara, did you have any other ideas or comments?
Just I'll find out from I'll see if I can find out from Denise what they're looking at for a potential date, because I don't think that that's been announced yet. So then that way, maybe, I know I sent it out as early as I possibly could last year, so that way we get it on everybody's schedule. And then maybe people could, since it is in April, we're talking ahead of time, maybe people can get block it off on their schedule. So, yes, Kim, I will do that as soon as, I have a date to provide. And I'll reach out to them too and see, maybe we can write a letter or something, Gemina, to them, or just a formalized email just to say, we would like to, participate in this way. I know that they have opportunity to speak. If anyone would like, to kind of make that public announcement, it is typically covered on the news, and there are legislators there as well that we can engage with. So I will send, it sounds like there's enough interest, we can formalize something.
Excellent. Yeah, I appreciate that, everyone. Okay, and then wrapping up, one of the other final ideas, as we are approaching the end of 2025, we only have one more meeting left, a council meeting left on the calendar, and our subcommittees aside. I would like it if we could start thinking about what our priorities will be for 2026. I know this is a big, tall order, but we should have some idea of goals. I especially like, looking at the work that our subcommittees are doing for some input there. But for all of our appointed members, we need your voice, whether you're a parent, an advocate, an educator, provider. We need your input. And so this is my formal request for you to put your thinking hats on, and number one, prioritizing what's low hanging fruit. Kim already provided us with her update that she's got a letter template she can get sent out to us. But we need to solicit some input so that we're all in agreement here. What I do need, Tara, if I could ask you, put you on the spot, can you remind us what the budget cycle is? Because I think it would be helpful even for me, as I'm not immersed in all things legislative in my day job. If you could remind us what the budget cycle is, and what we might look at in terms of legislative recommendations, and that might inform, for this group, where we might put our priorities.
Sure. So the state budget was passed in the last session. So this upcoming session, which will start in February, is not, technically like a budget year. Doesn't mean that there's not changes to the budget or, balancing or, I know that there, so we're also talking about a special session that, has not been formally announced, but there's, the governor has, discussed it, the legislature has discussed it. So that primarily is being open to discuss some of the bills that were vetoed by the governor, specifically the housing bill, and then also with some of the changes that have happened at the federal level, it's the state's response to some of those changes. So the changes, for example, that have been made to SNAP benefits and stuff like that. So the special session may occur. We don't have a specific date yet to discuss some of those topics specifically. But then the formal, session starting in 26 will begin in February. Not a budget year. Budgets may be negotiated or addressed because of some of those presenting issues. But then the typical budget cycle would be the following year in that session. So it's a 2-year biannual budget that the state does.
So with that being said, maybe I would actually solicit feedback maybe from our agencies, given all the federal cuts. You know, Brian, I'm going to put you on the spot. Like, is there something that the council could help you with in terms of education and we could do a letter of support and something or oppose something. And I'm looking at, any of our other agency designees that you're seeing come across your desk. It's impacting, the autism population that you serve, and something that, you also have priorities that we could then, dovetail with you or piggyback on with you. Not to put you on the spot or a response right now, but that would be something I'd like to request that you think about, or if there's someone else that we can speak with, on your teams, I'm happy to connect with them too. But a rising tide raises all ships. We're here to serve and make recommendations. And so that's really where I want to make sure we're not missing any opportunities here to provide that support. Whether we're advocates, parents, providers, educators. So I'll pause here. I don't know if anyone else has anything they want to chime in or add, but those were some of the ideas for new business that I think we need to start thinking about for 2026, especially the federal cuts is hitting our populations across the board.
Yeah, it doesn't help that we have somebody in the federal government who shall remain nameless, who keeps spreading lies about the autism community, saying Tylenol does not cause autism, and we're not burdens. We do pay taxes. That doesn't help our cause either, that we have this person who's so high up that's spreading lies about us.
No, it doesn't.
Just a couple comments as far as our federal funding for the State Department with regard to the IDEA grant. We did receive that grant. There was minimal reduction to it. So our grant's around 158 million, most of which 85% of those dollars go directly to the LEAs. We're a pass-through, so LEAs are just finishing their applications now for those grants. So that's business as usual in that context. There was a 365,000-ish reduction in the 158 million, so relatively flat funded in the context of the dollars that go to our school districts, as well as the state has set aside funds which we utilize for supporting our surrogate parent program, our dispute resolution processes, all of the professional development and technical assistance that we provide. And so we did recently hear a couple of weeks ago that our state personnel development grant, which is a discretionary grant, that's in Part D of the IDA grant, that those are competitive grants that states can apply for building capacity in the state. We were awarded that grant 2 years ago, and we found out last Friday that the grant was no longer going to be continued as of the end of the. We are appealing that decision, and we have a case for our argument to continue, which we hope will happen. That was a $5+ million grant, and we were in year 3 of those activities. So that was obviously concerning and surprising to get that information and to have to respond so quickly. But we keep the council updated on those activities. The other thing I wanted to mention is our State Advisory Council for Special Education is another legislatively mandated group. Every country has one, and folks are appointed. Half of the council are parents and or individuals, and the rest of the council are appointed from various agencies and so forth. And they're also engaged in priority setting for the year, which is a continuous process. So we're happy to share those with the committee and the council. And then you've heard me previously also discuss our autism eligibility guidelines for our school districts. Those are in the final stages of approval now, so we're very close to having public comment on that. So once that document is ready for public comment, which I anticipate in the next few weeks, we'll be happy to share that with members of the council for their input and feedback before we do finalize that and implement it across the state.
Great update. Thank you very much, Brian.
You're welcome.
And the how long will the public comment window be open typically, or you don't know yet?
It's between 30 and 60 days.
Okay.
So it's
right.
within that framework
right.
timeline.
All right, excellent. And when do you anticipate for the appeal of the decision on the 5 million, when do you anticipate hearing back from that, or do you have any idea yet?
I don't have an idea. I'm hopeful to respond back to us before October 1st.
Okay.
So
all right, well, fingers crossed.
As we were supposed to receive our funds for this year on October 1st.
Okay. Okay. All right. Great update. Anyone else? Okay. Tara, I don't have anything else on the agenda. I'm just looking to see if there's anything else here in the comments.
I think just anything else for the good of the order.
Okay. Yeah, we packed a lot into this meeting, and there's a number of follow-ups that came out of the meeting. So check your inboxes. You'll be hearing from us. And as always, we post on the autism website off of OPM at the state of Connecticut for minutes, videos, contact information. Always happy to hear from the public. Okay, hearing nothing, I'm going to prepare to adjourn. Thank you everyone for your participation. I hope you have an amazing day and enjoy the rest of your week.
Bye everyone.
Bye.
Thanks for joining.
Bye everyone. Thank you.